Hey everyone, Dr. Mike here. Welcome back to the channel. Today, we're talking about a topic that might surprise you, how the health of your feet can actually give you clues about your liver. You heard that right, your liver. We often think about our liver when we think about things like alcohol consumption or fatty foods, but did you know that your feet can actually show signs of liver disease? It's true. So if you're experiencing any unusual changes in your feet, don't ignore them. They could be trying to tell you something important about your overall health. Stay tuned, because we're going to break down 5-foot symptoms that could indicate a problem with your liver. Alright, let's jump right into it. Today we're going to talk about something that might seem minor but can actually be a significant indicator of your overall health. The first foot symptom we're going to discuss is spider veins. These tiny, web-like veins can appear on various parts of your body, but today we're focusing on the feet. Now, you've probably seen spider veins before. They're those small, thin, red, blue, or purple veins that appear close to the surface of the skin. They can be quite noticeable and sometimes even a bit alarming. They kind of look like a spider web, hence the name. But don't let their delicate appearance fool you. They can be a sign of something more serious. While spider veins can be caused by a variety of factors like genetics, prolonged standing, or hormonal changes, they can also be a sign of liver disease. Yes, you heard that right. Liver disease. Why? Well, when the liver isn't functioning properly, it can lead to something called portal hypertension. This is a condition that can have far-reaching effects on your body. Portal hypertension is basically increased pressure in the portal vein, which is the vein that carries blood from the digestive organs to the liver. This vein is crucial for transporting nutrient-rich blood to the liver for processing. This increased pressure can cause blood to back up into smaller veins, including those in the feet, leading to the development of spider veins. It's like a traffic jam in your circulatory system. Now, I know what you're thinking. Dr. Mike, I have spider veins. Does that mean I have liver disease? It's a valid concern, but let's not jump to conclusions just yet. Not necessarily. Remember, spider veins can have many causes. They can be due to something as simple as standing for long periods or even just your genetic makeup. However, if you notice spider veins on your feet or anywhere else on your body, it's definitely worth getting checked out by a doctor, especially if you have other risk factors for liver disease. These could include things like a history of alcohol use, obesity, or other underlying health conditions. Early detection is key when it comes to liver disease, so it's always better to err on the side of caution. The sooner you catch it, the better your chances of managing it effectively. So don't ignore those spider veins. They might be trying to tell you something important about your health. Pay attention to your body. It's always communicating with you in subtle ways. Moving on to our next foot symptom, itchy skin. It's something we've all dealt with at some point in our lives. Whether it's a mild irritation or a more persistent problem, itchy skin can be incredibly frustrating. We've all experienced itchy skin at some point, right? It's a common issue that can be caused by a variety of factors, from dry weather to insect bites. It's annoying, but usually not a cause for concern. Most of the time, a good moisturizer or an over-the-counter cream can provide relief. However, if you're experiencing persistent itching, especially on your feet, it could be a sign of an underlying liver problem. Persistent itching that doesn't go away with typical treatments should not be ignored. One liver condition that's often associated with itchy skin is primary biliary cholangitis, or PBC. This is a chronic disease that can have serious implications if left untreated. PBC is an autoimmune disease that slowly destroys the bile ducts in the liver. These ducts are essential for the proper flow of bile, which is crucial for digestion. Bile is a fluid that helps with digestion and fat absorption. Without it, our bodies would struggle to process the fats we consume. When the bile ducts are damaged, bile can build up in the liver and spill into the bloodstream. This can lead to a range of symptoms, including intense itching. This buildup of bile can cause intense itching, often on the hands and feet. The itching can be so severe that it becomes a constant distraction. The itching can be so severe that it disrupts sleep and affects quality of life. Imagine trying to get a good night's sleep while constantly feeling the need to scratch. Now, itchy skin can be caused by a lot of things, like dry skin, allergies, or skin conditions like eczema. It's important to consider all possible causes before jumping to conclusions. But if you're experiencing persistent itching, especially if it's accompanied by other symptoms like fatigue, jaundice, or abdominal pain, it's important to see your doctor to rule out any underlying liver issues. Early intervention can make a significant difference. Remember, early diagnosis and treatment are crucial for managing liver conditions and preventing further complications. Don't wait until the symptoms become unbearable. So don't just scratch that itch, get it checked out. Your health is worth it. Chapter 3. Let's talk about another foot symptom that you should never ignore: tiny red dots. These small red spots might seem insignificant at first glance, but they can be a crucial indicator of underlying health issues. These dots, also known as petechiae, are actually tiny blood vessels that have burst under the skin. They can appear anywhere on the body, but are often noticed on the feet and ankles due to gravity. They're usually harmless and can appear after minor injuries or even from straining. For instance, activities like heavy lifting, intense coughing, or even prolonged standing can cause these tiny blood vessels to burst. However, when these tiny red dots appear in clusters, especially around the ankles or feet, it could be a sign of liver damage. The liver plays a vital role in many bodily functions, and its health is crucial for overall well-being. One of the liver's many functions is to produce proteins that help with blood clotting. These proteins are essential for preventing excessive bleeding and ensuring that wounds heal properly. When the liver is damaged, it may not produce enough of these clotting factors, which can lead to easy bruising and bleeding, including those tiny red dots on the skin. This can be an early warning sign of more severe liver issues. So if you notice these dots appearing more frequently or without any obvious cause, it's essential to consult your doctor. Early detection and treatment can make a significant difference in managing potential health problems. It's also worth noting that tiny red dots on the skin can also be a sign of other health conditions, such as diabetes, which can also affect blood circulation and clotting. Diabetic patients need to be particularly vigilant about any changes in their skin. So, it's crucial to get a proper diagnosis to determine the underlying cause and receive appropriate treatment. A healthcare professional can run tests and provide guidance on the best course of action. Remember, even seemingly insignificant symptoms like tiny red dots can sometimes point to a more serious underlying issue. Paying attention to your body and recognizing these signs early can lead to better health outcomes. So, don't hesitate to seek medical attention if you have any concerns. Your health is your most valuable asset, and taking proactive steps can help ensure you stay in the best possible condition. Chapter 4. Now let's talk about swelling in the feet, also known as edema. Edema occurs when fluid builds up in the tissues, causing them to swell. It's a common symptom that can affect various parts of the body, including the feet and ankles. While edema can be caused by a number of factors, such as prolonged standing or sitting, pregnancy, or certain medications, it can also be a sign of liver problems. When the liver is not functioning properly, it can disrupt the body's fluid balance, leading to fluid retention and swelling. This is because the liver plays a crucial role in producing a protein called albumin, which helps to keep fluid in the bloodstream. When albumin levels are low, fluid can leak out of the blood vessels and into the surrounding tissues, causing edema. So, if you notice persistent swelling in your feet, especially if it's accompanied by other symptoms like fatigue, abdominal pain, or yellowing of the skin or eyes, it's essential to see your doctor to rule out any underlying liver issues. Remember, edema can be a sign of various health conditions, and it's important to get a proper diagnosis to determine the underlying cause and receive appropriate treatment. Chapter 5. Finally, let's discuss the most well-known sign of liver trouble: yellowing of the skin, also known as jaundice. Jaundice occurs when there's a buildup of bilirubin in the blood. Bilirubin is a yellow pigment that's produced during the breakdown of red blood cells. Normally, the liver processes bilirubin and removes it from the body through bile. However, when the liver is damaged or diseased, it can't process bilirubin efficiently, causing it to accumulate in the blood and tissues. This buildup of bilirubin gives the skin and the whites of the eyes a yellowish tint. Jaundice is often one of the first noticeable signs of liver problems and should never be ignored. It can be a sign of various liver conditions, including hepatitis, cirrhosis, and liver cancer. If you notice any yellowing of your skin or eyes, it's crucial to seek immediate medical attention. Early diagnosis and treatment of liver problems are essential for preventing further damage and complications. Remember, jaundice is a serious symptom that should never be taken lightly. If you experience this symptom, don't delay seeking medical help. Outrow. So there you have it, 5-foot symptoms that could indicate a problem with your liver. Remember, your feet can reveal a lot about your overall health, so it's important to pay attention to any changes and address them promptly. If you experience any of the symptoms we discussed, don't panic, but don't ignore them either. Schedule an appointment with your doctor to get a proper diagnosis and discuss any concerns you may have. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health tips. Take care of your feet and your liver.